This is the side shot of the spine, okay?
Yeah.
Now, the good news, you have beautiful curve in your neck.
Yeah.
I expected it to be straight or reverse. This curve is good.
Okay.
This curve is a little bit less. The other good news, you have beautiful disc spaces in here.
Mm-hmm.
I didn't expect that either for you.
Mm-hmm.
Okay? It makes the work, the way you're going to respond and the way you respond to the work, it makes it easier. People who have thinning discs, it takes a little bit longer. They don't respond as well. And the femur headline represents the base. Let's say you're building a house.
Yeah.
You go get a piece of land. You need the level base.
Foundation.
No, base first.
That's the base.
Base is the land.
Yeah, yeah. Okay.
This is representing like the base.
Yeah.
Then you have a level base.
Yeah.
Then you build a foundation. Foundation should be level.
Yes.
However, if the base is not level, what do? You first level the base.
Yeah.
If you can't level the base, what do you do to the foundation, like building these houses in the hills?
Adjust the foundation.
Correct. Okay. What Dr. Gonstead found was under 7 millimeters, the spine will still maintain its adjustments, hold it.
Yeah.
If it's less than that, and that's what we're going to measure up, we're going to need to measure, is this a functional leg length inequality or a structural one? So the functional one, he came up with a formula for correction. And what he found, for every 5 millimeters of difference in the pelvis alignment, it would, let's say this is down 5 millimeters compared to the right. Raising it up 5 will raise the femur headline 2. It's a 5-2 ratio. So if the pelvis misaligns back, the vertical projection will be longer, larger number. If it misaligns forward up, the vertical projection is less. Okay? So we need to measure that. We also need to measure the sacrum. Why I'm saying this, all of this, remember we said if we don't have a level base foundation, the rest of the stuff doesn't hold. This isn't fused at all. This is just, you're building up the calcium, body stabilizing, number 1. Number 2 is that there's some low bone density in this area. This one in particular stands out to me. So you would think, oh, is there low bone density or is there calcium built up? There's both.
Okay.
And when I see that, historically what I've seen is this is related back to digestion. We talked about how the pelvis moves. When one side goes up, the other side goes down, one goes in, the other goes out. The auricular surface of the SI joint, when it goes down, it naturally comes out a little bit. When it comes up, it naturally goes in a little bit, right? Your left side has gone up and out.
Mm.
The out component is more significant than the up component. And then the right sacrum is doing this, right side. And then it's tilted down on that side. All of that disconnect, there was some trauma at some point, whenever that was. It wasn't yesterday, it wasn't even a few years ago, it was a while ago. So in order to really correct, we got to determine between these two, what are we going to set and really focus on that. This needs to be stabilized for any of this to have a long-term result. It's not coming from here. We need the full to where is it coming from?
Yes, yes, yes.
Okay?
Yeah.
That was the key with this.
Yes.
We now know no one does this x-ray. You don't see that in this x-ray that you brought me.
Yeah, naturally, yeah.
Okay? You know how many times I get neck issues and they bring me a neck x-ray and it's coming from the mid-back. Hundreds of cases. Everyone else missed it. It's not that I'm this genius that figured it out. I just had the right information. Right?
Will it be painful, this adjustment?
You already went through the worst.
Sure.
That was the worst, yes.
But on record.
I'm on record, yes. It was the worst.
Okay.
Okay?
You can't be so harsh.
It won't get worse.
Sorry.
No, it's okay. It won't be harder than whatever it was, okay? I can go lighter, but I only have 2 days with you.
Okay, yeah.
The more you walk, the more it loosens up.
Yeah, it's,
The more you focus on foundation and postural exercises, I'm going to give you all that
yeah,
stuff anyway.
Sure.
You do it, but she still needs the adjustments.
Yeah.
Okay, that's whether it's with me, New York, anywhere, she's still going to need them. So you did well that day, and yes, that was 2 days ago, not yesterday.
Yeah, 2 days ago. Yeah. First day.
So I have to decide also now. Okay, because like I said, we don't have the luxury of time. That's 3, 4, 5, sacrum. Okay.
A little bit.
Yeah, we're gonna do the sacrum today, here, bottom right. Let's see, check the mid-back, and I have to do the neck.
How much time do you think we require?
6 to 8 weeks.
6 to 8 weeks.
If you want to correct the pelvis. Not the pain. That's the easy part. Other people will tell you a year. Head down. Or they'll say, no, you can't do it. Which one hurts the most?
Ama.
2, 3. I'm going to get there. 1, 2, 3, 4, 5, 6, 7.
5 and 6 more.
Yeah. Let's do 6. Continue on sacrum. Let's start with the neck. Shoulders down. Nice and easy now. Left ear down, down, down. There you go. Proper. Nice. Breathe. Good. Bus. 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 Bus.
No,
Bus.
no, it's still there.
Bus. Give me your hands. Thank you. Give me your hands.
Done.
I'm going to do your mid-back still, but that I need you to walk right now. One thing though, energetically, you don't want to walk like this. It's very bad energetically like this.
Yeah, keeping hands
You know
back.
why? No, you see a lot of older people
Yes,
doing
yes.
that. We are designed to swing our arms.
Yeah.
Okay? And energetically, old Oriental medicine, even
Leaning here a
Ayurveda,
little bit.
walk. Remember I said, we're moving things that have been stuck. She needs to just walk it out now.
Uh-huh.
Okay?
More painful?
I'm going as light as I can to get the pressure off the nerve.
Okay.
That's it. I'm going to do this on the sides of the bone so it doesn't hurt you as much, okay? Arms down to the floor. Down to the floor. Down, down, down.
Down to the floor. Or?
Bas, bas. She's mad at me, but she's smiling too. I don't understand. Okay, I'm not done. Today you get a nice surprise. Come.
And
You're gonna get a nice buff and polish, not just alignment. Basically, this is oscillating vibration 170 to 180 hertz frequency. That frequency they found breaks up scar tissue. That's it. It sounds very loud. It feels good though. And we're just going around the areas just to make sure. Break up any scar tissue that's been there for a while. I'm barely touching it.
Yeah.
It's showing you how much congestion you have in your body, madam.
Yeah.
So, up, back, back. Shoulders up, back. Arms up in the air, up high. Doesn't hurt your back to do that, right? Your mid-back?
Not much.
She's doing fine. Let's check. Just so we know. Cool.